Welcome. This is Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone to have the knowledge to care for themselves in the best ways possible. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com. That's austinbpa.com. And please feel free to share. Thank you for joining us today. With us is Dr. Brown, a psychiatrist with ABPA, who's here to share some thoughts about our topic. And our topic today is depression. It's something that affects a lot of people, and especially over this last year and a half, with so much that's been happening, it's an important topic to talk about. So, Dr. Brown, let me turn it over to you. Will you please introduce yourself and tell us a little bit why depression is an important issue for you?
I'm Gregory Scott Brown. I'm a psychiatrist based in Austin, Texas. I direct a clinic called the Center for Green Psychiatry. I'm also an affiliate faculty member at the University of Texas Dell Medical School. And really, depression is the bread and butter of what any psychiatrist would work with on a day-to-day basis. It's an illness that affects millions, if not tens of millions of people in the United States and even more around the world. And it's an issue that I think a lot of people of color, particularly Black people, struggle with. And they don't necessarily feel like they have the resources or feel like they have what's needed to navigate those initial conversations with psychiatrists. So it's a topic that's very important for me, and I think should be important for anyone in our community.
Absolutely. You're right on the money. A lot of times you hear from the Black community that we don't like going to see a psychiatrist or a therapist. What do you usually say to families or people who tell you that or who mention that to you?
Well, the worst possible outcome for depression obviously is suicide. And so we have over 100 suicides a day, and suicide is most commonly associated with depression, right? And so I think that obviously it's difficult making that first step or taking that first step to go and get professional help, but we're talking about matters of life and death. I think that meeting with a mental health professional can definitely save someone's life, and it's worth that first conversation.
Absolutely. And to be a little vulnerable, because these conversations are letting our patients and our friends and family see that we're here to help the community. I just want to share that I'm an Iraq war veteran. I spent 14 months there. And it's been more than 10 years, but I'm finally coming to the acceptance that it's okay to talk about and to admit that I'm not okay, that things have happened that I need to talk about. And for me, what the hardest part was seeing other people who had it much worse, people who saw worse things than I did. And I was comparing myself, thinking that it's not bad enough for me to seek help. What would you say to people who just feel like they're not ready yet because it's not so bad compared to other people?
I would say, and thank you for sharing your story. I know that sharing stories like that aren't easy. I'd like to also say I'm a psychiatrist. I've struggled with depression. I've written about that openly for Men's Health magazine. But even the night before that article came out, I was sweating pins and needles, wondering if this is something that I should actually talk about. So, it's difficult to have those conversations and put yourself in a vulnerable position. But I would say to someone, just start where you can. You don't have to start off by, going on a podcast and telling the world about your personal, mental health journey. You don't even have to start off by going to see a psychiatrist. You can start off having a conversation about mental health with a friend that you trust. You can start off by talking about it with a family member or you go to church, set up a meeting with the pastor at your church. I mean, so there are a lot of people that you can start having conversations with. I think the most important thing, though, that we have to keep in mind is that we don't have to suffer in silence. And when we do, that ends up causing more harm than it does help us.
Yeah, I'm going to say that again. We don't need to suffer in silence. My specialty is working with teenagers. And part of what we do daily is that screening for depression, getting people to try and talk about it. And it's not easy, but we have to try and be able to listen and open up. So one other group I want to add to your list of people to talk to, besides family, friends, teachers, coaches, is sometimes your primary care doctor. You fill out that screening, be honest and say when you're having the bad days. And I would also push you that if you've marked you're having a bad day and your provider didn't say anything, have the courage to tell them or ask them, what about that screening I did?
Yeah, I mean, and that's the thing, as we're learning more about mental illness and it's becoming less stigmatized, I mean, those conversations, I think, even with primary care providers, are a lot more available and accessible than they once were. So I would definitely encourage people to do that.
Great. Now, what about signs of depression? People sometimes think what you see on TV is depression, or you have to be really sad or something bad has to happen. What are things that people should look for and be aware of when it comes to depression?
So depression is this enigma. It presents in a host of different ways. So, I mean, if you look at the DSM is the way that kind of like the psychiatrist's diagnostic, manual, the way we diagnose depression. So you want to look at changes in sleep, changes in interest, feeling guilty or worthless. If you have, a period of time where you're experiencing low energy, low appetite, you feel like you're just dragging your feet through every day, your limbs feel heavy. That's actually a term called lead-in paralysis that's common with depression. And so again, if you're looking at the textbook definition, if you have 5 of those criteria for a period of at least 2 weeks, suicide is another one, experiencing suicidal thoughts, obviously, then that would give someone a diagnosis of depression. Now, the thing you have to keep in mind is a lot of people are experiencing depression. They have no idea that they're depressed. So sometimes it will present with, just feeling physically exhausted, feeling pain in the body. People will have, experience irritability. That's very common in men. They're not necessarily expressing that they're feeling sad or depressed, but their wife or their partner might notice that they're just so irritable, all the time. So I'd say, anytime someone's experiencing a change in behavior that just doesn't seem typical of who they normally are, then that would definitely warrant at least a screen for depression.
That's great. And I would add, for adolescents, sometimes we use the term, we worry if someone says they're bored, because being bored in an adolescence is not normal. There's always something to do. You can be bored at school, you can be bored with homework, but your life should not be boring.
Right. And also, one more thing I want to add too is if you lose, your ability to be future oriented, so you stop thinking about tomorrow. That's a big red flag for depression too, right? If you ask someone, what are you looking forward to, and they just, there's not really anything there. Then that would warrant some closer attention too.
Great. And can we take it one step further and talk about signs of suicidality too? Because one common one we often talk about is people giving their stuff away, or their mood suddenly changes from being really sad to seeming content with the world without a known cause. Would you share other signs or things that people should look out for with suicidality?
I mean, you got that right on the nose. I mean, the thing about suicide is very difficult, even for psychiatrists, to predict suicide. I mean, and one of the challenges is you will have patients, you could be working with a patient who is depressed for years, and they come to the office and all of a sudden they look, totally happy, right? That could be a warning sign, right? Like you said, if people are giving all of their stuff away, if there's an abrupt change in their mood. We also know that there are suicide risk factors as well. So if someone is engaging in heavy alcohol use, when it comes to marriage, that kind of is a double-edged sword, because if you're in a good marriage, the statistics show that, or the evidence actually shows that's a protective factor If you're in a bad or unhealthy relationship, that could be a risk factor as well. If someone has recently gotten out of the hospital, you'd be surprised. Someone might spend 5 or 6 days in a psychiatric hospital for depression. They get out the hospital feeling better, but the first few days to few weeks when they get out of the hospital, that's also a vulnerable time for a lot of people as well. So that being said, again, suicide is very difficult to predict. There are signs that we can look for that, we mentioned, but I think the most important thing is that we're all paying attention and looking for those signs, because people who are suicidal aren't always opening up with psychiatrists about it.
You're right. That leads right into what I like to talk about. In the military, we talk about the buddy system and that we're all responsible for each other. So what would you tell people to do if they suspected that a loved one or a friend was either depressed or suicidal? Do you have some words that people have found successful in helping other people?
I mean, don't ignore it, right? And so the thing about people who are severely depressed or severely people who are suicidal is they're not the most pleasant people to be around all the time. And I mean, I could speak from my personal journey going through depression. I mean, it's like looking back, I'm like, well, how did my parents, my family even deal with me, right? So, I mean, people going through it will try to push you away. They will do their best to push you away. And it's not really them that's doing it. It's the illness that's consuming them that's causing them to do that. And so I would say, just you have to smother them with love and do everything you can, to make sure that they get the help and attention that they need. You got to check on them, get your friends and family to check on them. Try your very best not to leave them alone. And then if they happen to push you away, I mean, you have to realize and tell yourself sometimes out loud, that's the depression that's speaking. It's not my friend. It's the depression who's doing that.
That's great. And I really appreciate how you keep referring to this as an illness, because for so long we don't treat it the same way as we do any other illness, but we really need to move in that direction.
Right.
Would you spend a few minutes talking about medicine? A lot of families, a lot of people are afraid that once they get on medicine, they have to be on it forever, or that medicine will change them. What are some things, and we know, you and I both know that we don't start with medicine. That's not how you start. But when it does get to the point and the discussion happens, what do you tell families and people about medicine?
So if we're just talking about depression, I mean, again, or if you're looking at the evidence, there's no evidence showing that if you have experienced one episode of depression or even multiple episodes of depression, that you'd have to be on a medication indefinitely for the rest of your life, right? So the purpose of the medication is to help a patient get out of the depressive episode so that they can again come off of the medication, right? So I like to use the analogy of, if someone's depressed, it's kind of like they're stuck in a ditch, right? They're trying to get out of that ditch. And they may be tapping into their self-care modalities, going to talk therapy, and they just keep sliding back in it. What the medication can do is it can kind of offer a ladder to help them crawl out of the ditch. But then it's that self-care, it's that therapy, it's all those other skills, those adaptive coping strategies that's going to keep them out of the ditch, right? And so typically with my depressed patients that I work with, first time depressed patient, they may be on medications for 8-9 months. And during that time, I also recommend the other things, right? The therapy, the self-care strategies, nutrition, exercise. And then once they feel better, I might leave them on the medication for a couple of months, and then I slowly try to get them off of it. That's what a typical course of treatment looks like.
That's great. And there are other things people can do, like exercise and meditation and
Yes.
Lots of other modalities that people need to be aware of.
Right. And so often, I mean, when people think about depression, they think about two treatments. They think about medications and they think about talk therapy. And there's this whole branch of self-care that people tend to ignore that is totally evidence-based. So we're talking about nutrition, breath work, movement, spirituality, focusing on sleep. I mean, there are tons of studies that we could do an entire different discussion on, just talking about how these things can actually benefit our mental health as well.
That's great. You provided some terrific information, Dr. Brown. Do you have any resources that people can go to if they're concerned either for themselves or for other people about depression?
Yeah, I mean, so the biggest one would probably be NAMI, looking up your local chapter of NAMI. And so what that would do is help offer different resources in your community with regards to mental health. I think Psychology Today is a great resource. It's an online database of different mental health providers. You could put in your zip code or whatever health insurance panel you have, read the different profiles on there, see if any of them connect with you. Ideally, and again, not every situation is ideal, but ideally, you'd be reaching out to multiple providers. And if you could meet with 2 or 3 different therapists and then decide on a goodness of fit, one that you really feel that you connect with. And then not only that, make a commitment to actually sticking with treatment for at least a few months, because it's going to be hard. It's going to be hard. It's going to challenge you. Then I think that increases the probability for long-term success.
I really appreciate you saying goodness of fit.
Yeah.
Because I do tell that to patients all the time. The therapist, the person you talk to, may not be the right person for you. And for you as a professional whose livelihood depends on people seeing you, to say that, that's really powerful. So thank you for saying that.
I don't want anyone sticking with me if I'm not helping them, right? So my most important goal, right, my primary goal is that my patients are getting better.
Yeah, yeah. And then I caution patients sometimes that if the fit is not right, to make sure it's not because the person is telling you what you don't want to hear, even though you need to hear it, but that your goals and you're not on the same path. That for me is more reason not to be the right fit for the person.
Totally, I agree completely.
Good. Well, as we wrap up, is there anything that you want to leave the audience, tips or points or anything we didn't say that you want to make sure that we hit?
I mean, I'm just glad we're having this conversation. I feel like mental health is something that everyone is thinking about, but we don't talk about it enough, right? And so I think the more we talk about it, the more we have these conversations, the more people hear these conversations, hopefully it'll inspire them to speak up and talk more about it as well.
Excellent. Thank you so much. For those watching, if you have questions or have recommendations of what we should talk about, please write to us at info@austinbpa.com. We are here to celebrate and to educate, and we are here to inspire the next generation. Thank you again for your time, Dr. Brown, and thank you all for your attention.
Thank you so much.